Our members or patients are the true primary healthcare providers in the healthcare system. That is, the majority of day-to-day management, whether it's acute illness or chronic illness, is actually done by patients for themselves and their families.
If that's a fact, then it's our responsibility to bring them to the maximum capability in that regard.
We have a healthcare system that was built basically to take care of acute illness, but in fact today chronic disease is the number one cause of disability, it's the number one cause of healthcare costs, it's the number one reason for utilization. So we really have to start building systems to deal with chronic disease.
First one is muscle relaxation, and that's actually an exercise we're going to do after break today. Then next one is guided imagery. That's imagining ourselves in a story told by someone else.
The Chronic Disease Self-Management Program, also known by other names such as HealthyLiving or Living Well with Chronic Health Problems, helps people with ongoing health conditions learn new skills so that they can live fuller, healthier lives.
The Chronic Disease Self-Management Program is an attempt to truly educate the true primary healthcare provider and to regard our members as one of our primary resources in doing this. That is, it's our members who know the real experience of living day to day with a chronic condition. And we're creating a circumstance in which they can share that with others in a way that is constructive, productive, and improves health and well-being.
Anyone else have an idea that's worked?
I have a little P.O. box. It has 7 days a week.
Workshops meet for 2.5 hours a week for 6 weeks.
The courses are lay-led, lay-participated in with guidance from professionals.
The entire course is taught according to a script. And so when we train leaders, we actually train them how to follow very, very detailed script.
These are groups to process one's chronic illness and to become more proficient at handling one's chronic illness.
We mixed them in the classes. There were people with chronic lung disease, chronic heart disease, arthritis, and stroke.
When I do relaxation, it helps out a lot. The walking helps out a lot. The exercising I don't have any trouble with because I have learned that I love it. I made a complete turnaround as far as the exercise goes with the pain.
The Chronic Disease Self-Management Program is the product of a rich collaboration between Kaiser Permanente and the Stanford Center for Research and Patient Education.
This was a randomized study in which we randomized nearly 1,000 people, actually a few more than 1,000 people, to either treatment or control status. And the treatment took the chronic disease course, the control group did not, and we measured them before they started and then 6 months later.
This study showed that participants improved their health status.
They report that their health is better. They have less health distress, less fatigue, more energy, and they're able to do their everyday activities and social roles with fewer limitations.
They also were much more active as far as behaviors. They did more aerobic exercise, they did more stretching and strengthening, they practiced cognitive symptom management techniques, and they reported that they had better communications with their physicians. Then as well, we saw 0.8 of a day difference between the treatment and the control group in days of hospitalization over 6 months.
After this successful 6-month randomized clinical trial, the Chronic Disease Self-Management Program was disseminated out Kaiser Permanente. A dissemination study in 6 regions, Northern California, Southern California, Ohio, Colorado, Hawaii, and Georgia, showed similar positive results. Improved health behaviors and health status, and lower health care utilization and costs.
You know, my sugar, and then I also throw in my high blood pressure, and then my exercise plan, and then my thoughts and feelings. So if anyone wants to have a copy of this, you know, it's much easier.
And when you ask the patients who participated in the course, what were the most important things for you in your participation? The answer was consistently that we learned from other people and we helped other people.
Not all depression can be taken care of with self-management. So please be aware that sometimes depression does need the help of a professional.
And we also learned through some initial testing, but it's better to have the course taught by lay people than it is by health professionals. And it allows for a particular kind of communication. If one or more of the facilitators, the teachers of the course, has the medical problem that the course is dealing with.
It seems to me that during this session, some of this type of conversation would start to happen. And would it be appropriate to use some of the problem-solving techniques at times if somebody seems to be kind of stuck?
Sure. We're able to train the lay leaders to be able to conduct this program in about 4 days. We do that by providing a very carefully scripted program and curriculum.
And then at the end of that training, we always actually see them practice teach. And it's not until they've done their practice teach that we really decide, is this somebody that can beat it or not?
What we're talking about here is that you have a belief within yourself that, yep, I can do this.
We really urge them to tell the people in their classes when they need to go and ask the doctor about something. We definitely do not give medical advice. So somebody will come and say, well, what about this medication? I just read this in the newspaper. The reply is always, please go see your doctor.
And now depression can cause stress, or depression can cause fatigue, so it might not be the disease that's causing the fatigue.
The entire course is so highly structured that literally every minute is written out. This exercise takes 15 minutes, and you do activity 1, 2, 3, 4, and 5 in this order.
If you remember the circle, this symptom cycle that we looked at, that fatigue doesn't necessarily have to be caused by the disease.
Every session is built upon every other session. So, for example, we'll teach exercise maybe 4 or 5 sessions. We'll teach cognitive techniques 3 or 4 different times during the course. We will do problem solving every single session. We'll have people make action plans every single session.
Well, we're going to go ahead and finish up with our favorite part, making our action plans for next week.
I'm going to continue doing exercises, walking, and then I'm going to, I've been doing 10 minutes on the exercise bicycle, but I'm going to go 15 minutes 3 times a week. And my confidence level is an 8.
Wonderful.
I'm going to write in my journal, increase my time on my cloud walker, and my confidence level is 8.
What an action plan does is it allows them to focus on what they would really like to do. And on a week-by-week basis, sort of set very reasonable goals and sets them up for success versus failure.
So we'll start out with our feedback and problem solving from the action plans.
I did do the journal, but I didn't exercise as much as I wanted. So this week I'm just going to do the journal and exercise 5 days, not every day. And
okay.
And my level is an 8.
I continued to walk, like I said I was going to. And I rode my bicycle 3 times for 15 minutes.
Can I say I had her at the lake yesterday, and she did the entire lake because I walked with her. Yeah. She did the entire
Somewhere in the program, the light bulb usually goes off for the patient, where they understand that their doctor is not going to fix and cure them, that the other patients in the program are not going to fix and cure them, that they have to take an active role in self-managing their condition.
Since you have diabetes, we have a class called Healthy Living with Chronic Conditions.
The question often comes up, should be referred to the program. Since it's designed to address the core coping skills across chronic illness, it really doesn't matter what condition the patient has. Almost everyone's eligible. Now, of course, there needs to be a certain level of mental functioning and health to be able to even travel or participate in the program. But beyond that, don't prejudge. Let the patient decide about this valuable resource. Just encourage them to consider it.
On Saturday of this week, I'm supposed to go to a baby shower, and there's 23 steps, which is a lot of steps, and I'm going to go. I don't know how long it'll take me to get up those steps. If I have to, I'll turn around, sit down, and go up on my butt. But I'm going to go to that shower.
And your confidence level for the going to the shower?
What's the highest we got? 10.
The patients I've seen go through the program tend to be less angry and less sort of frustrated, often at the system or physician, for not making them better or perfect.
The research results from this project indicate that it's a win-win-win. Namely, the patients win because they enjoy better health, Their health behaviors improve. They feel more confident and more in control of managing and living with their illness. The providers win because what they're getting is a more active, involved patient that they can truly partner with. And the system overall tends to win because we get a very high return on our investment.
I wanted to ask each person to share what they feel they've accomplished during the course.
I've learned to exercise, measure my food, and pick the right kinds of food.
I've learned that instead of just sitting back, I can accomplish things by doing a little at a time rather than not doing anything because I can't do it all at one time.
I think it's a great program, and if I could send 50% of my patients through, which are the ones I think that need it, my life and theirs would be a whole lot better.
We have a successful, proven program here. This is a real partnership between patients and providers. The referral, the encouragement, and the linking of patients with this valuable resource is going to be key if our patients are going to benefit from the program.
Well, I think one of the best barometers of how this course worked out was my wife suggesting that perhaps I'm calmer than I was before. And it has focused on coping with the situation.
Calmer feeling.
Calmer, cooler Bill.
Calmer, cooler Bill.